This hearing of the Oversight and Government Reform Committee will come to order. The Oversight Committee's mission statement is that we exist to secure two fundamental principles. First, Americans have a right to know the money Washington takes from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers because taxpayers have a right to know what they get from their government. We will work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. This is the mission of the Oversight and Government Reform Committee. Today's hearing focuses on how the President's health care law affects job creators in the economy. And with our mandate to protect taxpayers' money, now that we know Obamacare is a tax, it is particularly important that we protect that money. This hearing builds on previous hearings conducted during the Congress by Subcommittee Chairman Gowdy, including one this morning. We know that Obamacare makes labor more expensive. It requires employers of at least 50 full-time workers to offer a more expensive selected and mandated government health care. Or pay an insurance tax of $2,000 or $3,000 per worker. The law will discourage 63,000 businesses with between 40 and 59 workers from expanding. If those industry companies below 50 choose not to expand and not to offer or pay the fine, it still won't change the fact that government will, in fact, tax another $2,000 the worker for not buying insurance. And, of course, that insurance without an organized health care plan of at least minimum nature will be inherently more expensive. 90% of employers report that Obamacare will increase their organization's health care cost. The other 10% clearly haven't checked the price. Although some of the cost increases will be passed on to customers, most will be passed on to workers in the form of lower wages or lost job opportunities. Let's make no mistake, competitiveness in a global market does not allow prices to ultimately rise to any point hoping that we can be competitive. There's a darn good reason that you don't buy Greek cars or Greek electronics. 74% of small businesses say the President's health care law makes it more difficult to hire additional workers. The Congressional Budget Office projects that the law will lead to 800,000 fewer jobs by the end of the decade. A paper by economists at Harvard and the University of Chicago finds workers more negatively affected by the law are disproportionately young, female, or minority, and those just starting out in the workforce. Obamacare increases government employment, particularly at the IRS, where thousands of new IRS agents will be charged in enforcing compliance with the law that taxes and mandates. According to projections, the greatest percentage of growth in Federal health care spending comes from the Federal Government's administration of health care. In other words, Medicare, Medicaid are already, in fact, expensive, fail to deliver value programs. Let us make no mistake, everyone on this dais wants good, affordable health care. Where we differ is on whether or not Obamacare delivers affordable health care or simply mandates a series of nice-to-have, good-to-have, or in some cases need-to-have requirements, but does so in a way that creates some of those 12,000 already produced new pages of regulations. One part of the law aimed toward assisting small business has already failed miserably. Obamacare contained tax credits for small businesses to offer health insurance. So few businesses claimed these credits because it was overly complicated and required businesses to fill out 7 different duplicative forms. This failure is symbolic of the bureaucratic approach of the President's health care law. this this single-party law is typical of what happens when you produce 2,400 pages of documents, pages of a bill, in the dark, bring it to the floor, and then say we must pass it so we can find out what's in it. The law, which spends more than $2 trillion over the next decade and increases American taxes and premiums, is unaffordable. I look forward to hearing from business owners, and business owners, remember, are employers. They're the people who create the private sector jobs that pay for everything, including the government jobs this President is so fond of creating. For many reasons, tomorrow the House will vote to repeal Obamacare. There is no doubt that our health care system needs reform, but these reforms must lower the price of health insurance rather than increase the burdens on employers and workers with higher taxes and federal spending and more government red tape. With that, I recognize the distinguished ranking member, Mr. Cummings, for his opening statement.
Thank you very much, Mr. Chairman. This week, the Republican House leadership has scheduled yet another debate and vote on the House floor to take away access to health insurance coverage for tens of millions of Americans. They also want to eliminate key protections that were passed as a part of the Affordable Care Act. Without legitimate ideas of their own on how to replace the Affordable Care Act, House Republicans simply want to gut it, and they want to rehash the same debate over and over again. Speaker Boehner proudly highlights on his own website that the House have already taken, and I quote, 30 votes to scrap the President's health care law, end of quote, during this Congress alone. 30 votes, despite the fact that the Senate has already rejected this legislation. It is difficult to imagine a more monumental waste of time. The only difference between the first 30 votes and the vote scheduled for this week is that the Supreme Court, in a decision by Chief Justice John Roberts, has now ruled that the Affordable Care Act is constitutional. Nevertheless, this week we will engage in another exercise in futility by spending hours and hours debating vote number 31. Unfortunately, today's hearing is part of this needless exercise. We are rehashing the exact same ground the Health Subcommittee covered a year ago in a remarkably similar hearing entitled, and I quote, Impact of ObamaCare on Job Creators and Their Decision to Offer Health Insurance, end of quote. As we learned back then, the Affordable Care Act will extend health insurance coverage to 30 million people. Millions of young adults have already gained access to health coverage through their parents' policies. Medicare beneficiaries are paying lower prescription drug costs, and more than 86 million Americans have benefited from preventive care free of charge, such as mammograms. At the same time, hundreds of thousands of small businesses are receiving tax credits to maintain and expand health coverage for their employees. And millions of Americans are now receiving rebates under a new rule requiring that insurance companies spend at least 80% of their premium dollars on health and medical services or refund the difference. Imagine that, insurance companies returning your money rather than doling it out to corporate executives. This year alone, individuals are expected to receive $426 million in rebates from their insurance companies, and small businesses are expected to receive $377 million. These are significant accomplishments that will help millions of people in very real ways. And there are more changes to come as additional provisions of the Affordable Care Act come online in the next 2 years to reduce the cost of health care further and provide patients with additional protections. Despite these accomplishments, Republicans will continue the same old scare tactics today, warning about massive job losses and economic ruin should the Affordable Care Act continue. The main problem with their theory is that it did not happen in Massachusetts. In 2006, then-Governor Mitt Romney signed into law the model for the Affordable Care Act, including subsidies for individuals purchasing coverage, a health insurance exchange, insurance market reforms, and mandates for employers and individuals. As a result, Today, more than 98% of Massachusetts residents are now insured with no indication of negative job consequences. With a 6% unemployment rate, Massachusetts remains significantly lower than the national average. The fact is that the Affordable Care Act, passed by both houses of Congress, signed by the President of the United States, and now upheld by the Supreme Court, is vital to the health of our people and the strength of our nation, and it will, without a doubt, save many American lives. Let's put an end to this pointless political theater. The Supreme Court has spoken and has spoken loudly. It is time to focus on ensuring that the law is implemented effectively and efficiently so that the American people can take full advantage of its protections. Mr. Chairman, I ask unanimous consent that Representative Bill Keating from Massachusetts welcome his senator from his state.
The gentleman will be recognized to introduce his representative. And with that, we go to the distinguished doctor from Tennessee, Dr. Desjardins, for an opening statement.
Thank you, Mr. Chairman. I would dispute the fact that we've been told that this is an exercise in futility or an unnecessary hearing. We have a number of job creators from around the country, and I've talked to a number in my district in Tennessee who are very concerned about what this Affordable Health Care Act, and it's hard for me to even say that because it's been proven unaffordable, will do to their ability to hire employees and expand and grow their businesses. It has done nothing but create more and more uncertainty. It has given us over 12,000 pages of regulation. And, why? I think that's a fair question. Why should we bring it to the floor to vote to repeal it again? It was pointed out that we had made 30 votes already to repeal this. I think the answer to that question is because this is a law that the American people did not ask for, they didn't want, and they can't afford. 63% of people opposed this law when it was passed in the dark of night behind closed doors without transparency, and they continue to reject it. The majority of Americans still do not like this bill. So I don't think that we just give up on the American people. I think we continue to fight for them. And now that this has had to go to the Supreme Court, and part of it was ruled unconstitutional, about states having to expand their Medicaid programs, which are already stretched and breaking a lot of states, now we have a chance for maybe some of the Democrats who voted for this the first time to listen to their constituents. The ones that are still left that were not voted out of office in 2010 can do the right thing and vote to repeal this bill now that we know it's a tax. I don't think anybody sitting up here thinks that this bill would pass again today if it were brought to a vote, because it was done in a fashion that was deceitful. It was clearly called a penalty, and now it's only constitutional because it's a tax, and they still don't want to call it a tax. This president vowed to not raise taxes one dime on the middle class, not one dime, but clearly this is one of the largest tax increases in history. It's one of these bills that Nancy Pelosi said, we have to pass to see what's in it. Sometimes maybe you have to pass a bill to see what's not in it. Business owners are going to find, who have over 50 people, that there is no language in this bill that even allows for them to collect the taxes of $3,000 per employee against your companies. If the state does not set up an exchange and the federal government comes in and sets up an exchange, there is no language in this bill that allows for them to charge you that, and you have a right to know that. So this hearing is far from meaningless. We're doing the people's work here, and this is the job of oversight, and with that, I yield back.
Gentleman yields back. With that, we recognize the gentleman from Ohio, Mr. Kucinich, for an opening statement.
Thank you very much, Mr. Chairman. Prior to the Affordable Health Care Act, at least 50 million Americans didn't have health care. Why? Because they couldn't afford it. I mean, think about that. These are members of our family, they're our friends, our constituents. They couldn't afford health care. Even with the Affordable Health Care Act, there will still be people who will be hard-pressed. What are we supposed to do in America? We're supposed to tell people that because they can't afford health care, they're just condemned? And what about those people who were able to afford health care? If they had a claim, their expenses could be run up to the point where they weren't able to pay the extra expenses associated with an illness. Do you know about half the bankruptcies in America are connected to people not being able to pay their hospital bills? So this isn't just a narrow health care issue. This is a societal issue that determines what kind of a society are we. Are we a society that's going to drive people into poverty because they get sick? Illness doesn't respect political parties. You can be a Democrat, Republican, Independent. You get ill, your house could be on the line. Your life savings could be on the line. Everything you worked a lifetime for could be on the line. We're going to get back to this kind of thinking. You know, we're involved in polemics here. We need to look at the practical application of the law. Now, look, like some of my colleagues, I wasn't for the Affordable Care Act in the beginning. Why? Because I'm for universal single-payer, not-for-profit health care. I don't believe in for-profit health care. I think that if you're talking about health care reform, though, we were able to at least prove that reform within the context of a for-profit system was possible. I mean, if we couldn't even prove that, then later on, when those of us who want to continue to advocate for a single-payer system, we're told, look, it wouldn't be possible, well, how could we challenge that if we had participated in the defeat of the only thing that was in front of the American people at the time? Is this plan perfect? No. No one's maintaining that. But it is addressing what is a fundamental problem in our society, and that is lack of accessibility and lack of affordability to health care. And we must not lose sight of that. You know, elections come and go. But the outcome of this election in 2012 may or may not solve the health care problems of tens of millions of Americans. Now, there's another issue here, too, that I want to put on the table right now that really ought to take place in these discussions about health care, and that is each one of us does have some responsibility for our own health. Government can't give me health care. I had to change my diet years ago to have a chance at health care. The government couldn't do that for me. I had to make my own decision. Government doesn't tell me what to eat, nor should it. We have to create a more health-conscious society where people are given more information about the choices that they can make that can lead to better health, so that we don't have a situation where through a lifetime of bad choices, people then come to a system that is already overburdened with high costs and add to it. So there is an element of personal responsibility here which should never be ignored. But that then goes into how do we redescribe health care? How do we re-engineer a health care system to include diet, nutrition, to include physical education, those kind of things? We need to broaden the discussion. Unfortunately, this discussion that we're having here isn't going to do that for the most part. It's about polemics. It's about the next election. But sooner or later, we're going to have to come to grips in this country with the fact that we have a fiscally unsustainable health care system. And sooner or later, we have to understand that this step that we took in affordable care was the step in the right direction, although not by any means the final step. And for those of us who think that everyone should have access to high-quality, affordable health care, there's no question that in the long term and in the median term, we're going to need to go to a single-payer, not-for-profit system if for no other reason than to control costs. So with that, I want to thank the Chair for this opportunity to make that statement, welcome the witnesses, and I hope at some point we can really get into the details of what we can do to make health care available to all Americans, help businesses, help grow the economy, and put this highly charged partisan debate behind us. Thank you very much. Yield back.
Thank the gentleman. We now recognize the former chairman of the full committee, Mr. Burton, for an opening statement.
Well, first of all, Mr. Chairman, we do have to revise the health care system in this country. But there's an alternative which we have proposed, which is not being discussed today because the ObamaCare plan is in effect law right now, and it needs to be addressed before we can get to a solution that will solve the problem without putting such a burden on the future generations of America. I look out here today and I see an awful lot of young people in the audience. And when you talk about making sure everybody has health care, it sounds pretty good because it takes care of everybody. We don't have any problems. You get sick Everything's solved. The government's going to take care of everything. It sounds really good. What we don't say is that we're $16 trillion in debt. The interest on the national debt is humongous. These young people out here are never, ever going to be able to live the kind of life that we have because of the cost of government. And this bill is going to run it right through the ceiling. There's no question that we need to do something about health care. And all of us want to do that. But to create socialized medicine, which Europe is running away from right now. I'm chairman of Europe and Eurasia on the Foreign Affairs Committee. I just got back from over there. And I can tell you right now, those countries are on the brink of disaster. Spain is about to go down the tubes, and I think they probably will, even though it'll take a little time. Greece is about gone. Italy's in trouble. France will be in trouble. Ireland is in trouble because they've had a socialistic approach to government, and socialized medicine only compounds the problem. Yes, we have problems, and yes, we need to solve them, and yes, they need to be addressed, but they can be addressed in a business-friendly way that will solve the problems of the people of this country. Socialized medicine is not the answer. And to the young people out here who may be favoring this today, 10 years from now, 15 years from now, if this thing remains law, you remember what I'm saying right now, because we're loading a burden on your backs that you will not believe. We've already loaded $16 trillion on your backs and your kids and your grandkids, but this is only going to compound the problem. I yield back the balance of my time.
The gentleman yields back. All members may have 7 days in order to place additional opening statements in the record. And with that, pursuant to unanimous consent, I would recognize the gentleman from Massachusetts to introduce his witness.
Thank you, Chairman Eisen, Ranking Member Cummings. Before I resume my other duties in another committee, I want to thank you for the opportunity to address this committee and for inviting Senator Dan Wolf, who's not only the co-chair of the Joint Committee on Labor and Workforce Development in Massachusetts in the State Senate and a decorated Cape businessman, but a constituent of mine and a friend. We welcome him here today to testify. Cape Air's story is well known in my district, particularly in the Cape Cod area and the islands, where the company gets its name. I'm pleased that other business owners nationwide will hear this story and today and hopefully expand their successes through using the Cape Air model as an example. This example promotes success through caring for the company's surrounding communities and staff. Senator Wolf, thank you for being here today. Your testimony in today's hearing is essential to provide a firsthand account of the impact of the health care reform on small businesses directly from a CEO. I can personally attest to the strength of the Cape Air team, which has been crisscrossing the globe in Cessna 402 since 1989. Furthermore, the Cape Air team serves as a crucial link to the rest of the country and to the world. For many throughout Massachusetts, it's essential, but particularly for the Cape and Islands, where tourism is a driving economic force for those who live there year-round, like myself. I know that the airline has been at the forefront of national initiatives like healthcare and green energy initiatives for years. For this reason, the advent of the healthcare reform in Massachusetts, followed by the Affordable Care Act, and perhaps in the future, a strategy to curb greenhouse gases and switch to renewable energy sources, is an investment in preparedness. Again, I welcome my friend from Massachusetts to the Capitol and thank the committee for the opportunity to introduce him here today.
Thank you, Mr. Keating. Thanks for introducing your witnesses and for being here today. And with that, we'll go to the gentleman from Michigan for a similar introduction of, and I only barely let you have this. Remember, we're alumni together. The fact that he's a constituent is an accident of current address, but the gentleman is recognized.
I thank the chairman, and I think when you hear my introduction, you'll understand I even have more claim to him than you do as alumnus of the distinguished Siena Heights University in Adrian. Mr. Jamie Richardson grew up in my home school district of Onsted, Michigan. I watched him as a late high school student and as a student at Siena Heights University, outstanding student, outstanding athlete, outstanding character, developed to a point that ultimately after graduation he became a marketing guru at J. Walter Thompson, ultimately through a long chain of events, and you can read his resume. He ended up at White Castle Corporation, a family-owned business. And I think this is where it comes to the point of who Jamie is and why it's a privilege for me to introduce him today. I think what would be the first and foremost statement about Jamie Richardson is that he's married to Kate and has 5 wonderful kids that he spends unbelievable amounts of time with, intentionally making sure that that happens, even as he's involved in numerous other organizations and entities. White Castle Corporation is a family-owned business, which has its unique benefits as well as challenges in the world in which we live today, especially in relationship now to things like Obamacare. The challenge that we have there for family businesses is very strong. Jamie is presently the Vice President, Government and Shareholder Relations and Assistant Secretary. He was the gentleman involved in getting White Castle as the first company involved with Undercover Boss and worked with CBS in accomplishing that, indicating how that program would go and demonstrating how employees and employers must work together to complement each other to make business happen. He understands the benefits of job security and the opportunities for people to expand and grow. White Castle is known for its benefits, its security, its ability to reach youth, single parents, part-time adult workers, and et cetera, with a job that has benefits. And ultimately, with this law going into place, if it's carried out, will discourage and very likely do away with those same benefits that people stay at White Castle to work for. Mr. Richardson evidences his commitment to meeting needs of people by being involved in directorships, trustees with American Red Cross, Catholic Foundation, YMCA, Kiwanis, National Family Enterprise USA, on, giving back to the community, giving back to society, and making a commitment that ultimately goes again back to the family of Kate, those 5 kids, and people just like him. So it's a privilege to have Jamie here today. I look forward to your testimony.
Gentleman yields back. Now, for those not fortunate enough to have a personal friend on the panel, I will now introduce Mr. Michael Frederick. He is president and owner of MCM Composites. Welcome. Ms. Mary Miller is president and CEO of Jancoa Janitorial Services, Inc., and Dr. John Goodman is a health economist and president and CEO of the National Center for Policy Analysis. And with that, I would ask you all to rise pursuant to the committee rules, if you would please take the sworn oath and raise your right hands. Do you solemnly swear or affirm that the testimony you are about to give will be the truth, the whole truth, and nothing but the truth? Let the record, please have a seat. Let the record indicate that all witnesses answered in the affirmative. Mr. Richardson, being a returning contestant, I will expect you to be so good on this, but for the rest of you, it's like a stoplight. Green means go for some of your 5 minutes. Yellow means, as Mr. Gowdy said this morning, go real quick to get under it before it turns red, and red means stop. If you can stay as close to 5 minutes, I will ask members on the dais during questioning to do the same. Mr. Richardson.
Chairman Issa, Ranking Member Cummings, and members of the Oversight and Government Reform Committee, thanks for the opportunity to testify today on behalf of White Castle and the National Restaurant Association. My name is Jamie Richardson, and I serve as Vice President of Government and Shareholder Relations for White Castle. It's an honor to be able to share the impact the Patient Protection and Affordable Care Act is having on businesses like ours and the restaurant and food service industry in general, particularly on our ability to create jobs. White Castle is based in Columbus, Ohio, and we first opened our doors in 1921 in Wichita, Kansas. Soon after, we joined the National Restaurant Association as one of its first members. Still, to this day, we are a family-owned business and a privately held company. We employ nearly 10,000 team members. Most work in our 408 restaurants across 12 states. Our culture is one of family, and we proudly began offering health care coverage to our team members in 1924. White Castle offers a rich, full medical health benefit package after 6 months of service to any team member who is open to being scheduled for full-time hours, which we consider 35 hours per week. Year after year, employees name their benefits package as the reason why they come to work at White Castle and why they stay. White Castle prides itself on listening to team members and responding to their needs by offering benefits they want and use. We've incorporated wellness incentives, and since 2009, we've eliminated employee co-pays for regular checkups to encourage healthy lifestyles and to increase team members' use of their benefits to prevent illness. Under the law, White Castle and other applicable large employers like us will have to comply with the employer mandate, the automatic enrollment requirement, and extensive and detailed new reporting to the IRS on health plan offerings and each individual to whom it was offered. In 2014, we estimate our current plan cost could increase by over 20%. This estimate is dramatically different than what we have started to experience recently, as it appears our focus on wellness and preventive care is having a positive effect. Year to date, in 2012, our health care costs are trending and estimated to increase less than 3% compared with the prior year. As 2014, in compliance with the employer requirements of the law, fast approaches, we'll have to balance requirements of the law with employee needs and the ever-increasing cost of health care coverage. While we work in a castle, in our realm, there is no magic treasure room to cover these increasing costs without sacrificing job creation. The health care law will have an impact on jobs in the restaurant and food service industry. The only questions are how and to what extent. Some of the potential impact will be answered once we know the rules with which to comply and the implementing regulations, and hence the impact on our workforce. Everything we've seen has shown current cost will increase. Many in our industry are worried that our slim profits per employee will not be sufficient to cover the additional cost of more employees accepting our offer of coverage or potential penalties that may apply despite our best efforts to provide the required coverage. For White Castle, the uncertainty associated with the health care law has made us cautious to expand into new markets and impacted the number of jobs we are creating. We have conducted the extensive research necessary to explore expansion into other parts of the country, but have not acted on those plans yet due to the uncertain cost environment. If we were to pursue those potential expansion plans, it would bring 400 to 500 team member jobs, not to mention the construction and supplier jobs associated with opening new restaurants. In our business, we all manage risk. We do it all the time, whenever we launch a new product, for example. But the uncertainty of increased costs the health care law brings creates risk that no one can manage against. The result is that the growth and expansion of businesses that drive job creation is put on hold, and so are the jobs. In conclusion, for White Castle and the restaurant and food service industry, the law cannot stand as is. We need, in fact, we crave, reform that addresses the unsustainable increases in the cost of coverage. We must find solutions that will allow restaurant operators to offer great health benefits to their employees without excessive cost and regulatory burdens that threaten their businesses. Thanks again for the opportunity to testify regarding the impact of the health care law on job creators such as White Castle and the restaurant and food service industry. We have great gratitude for your service and all that you do for our country. We'd also like to offer, if anyone wants to come to a castle to work behind the counter and meet the hamburger heroes of White Castle firsthand, we'd welcome it.
Be careful for what you wish for. You know, when you get done with Congress, it may be the best job you have possible afterwards. And we'd probably be a move up in our in how the public would feel about us from 9 to 90% at least. Mr. Frederick.
Thank you, Chairman Issa and Ranking Member Cummings. Thanks for having me today, the committee. I bought MCM in 2001. We closed on the business 45 days after 9/11. So there was a bit of uncertainty, and certainly the economy right after we closed did not serve us well. We also had the disadvantage of, I call it being too smart to not know what you don't know. And so we had a big learning curve right after we bought the business. But we made it. We made it at least up until 2009, and 2009 was just a god-awful year. Our revenues were cut in half. We got down to 43 employees. We have 58 right now. We lost customers. We were working 2 days a week. All the salaried people got 60% of their salary. Just couldn't do it any other way. We had to balance cash, so we worked through that. Last year, they say there's a recovery. There's not. I would call it treading water. And you can see that in the fundamentals of our business, where things like customers are delaying orders. They'll place an order and then they'll call and say, "Oh, don't ship that." That's a good indicator that it's not good in the economy, and that's across all of our customer base. And also, there's not much investment in new tooling, and all of our parts are made with tools that are owned by our customers. So we have an early look at what their investment strategies are, and they're just not making any. The largest investor that I can see right now is actually a German company, and they're building $1 million worth of tools, and it's in the aerospace business, and that'll be good for us, but that's a small segment. So on top of this, we make, last year we did $7 million in sales. We made $138,000, which is peanuts. It's barely eking out a profit, and I think this year will be about the same. Our revenue is about the same. So I'm not optimistic. And on top of that, we now face something I was praying we'd never have to face, which is this new healthcare law, which is going to create God knows what. I mean, it's going to be a burden, to be sure, and it's going to be costly, and it's going to affect companies like ours and larger companies in hiring and the business. I think it'll be a general depressant on the entire economy. So what do we do? I mean, we have to live with it. I mean, we've persevered before, we'll persevere again. But what this act does is it changes our focus. I mean, we right now need to focus on our business. We need to expand our customer base. We need to, my time would be better served today calling on some prospects and trying to, generate some more business. But my focus is here because this is a real threat to us. It's going to add costs. I don't see how it can't add costs to the healthcare system. It doesn't do anything to address the basic problem, which is it's a dysfunctional market, and it's been dysfunctional since 1942. And what you've done here with this law is you've just made it more dysfunctional. You've taken a step in the wrong direction. And, that's unfortunately what we're going to have to deal with. So what do we do? I look at our company. We have, as I said, 58 employees. We're kind of on the bubble. We could get down to 50 and not be subject to this law and shrink our business. Well, who wants to do that? I mean, think about it. Why in the heck would you be in business so you can shrink your business? I mean, you want to grow your business and add people. So that's not a very good option. We could continue on with the plan we have, do nothing, and hope for the best. I think eventually we'll lose our plan. It's a high-deductible HSA. And it sounds like the Secretary of HHS will determine whether that's acceptable, which to me is repulsive in the first place, that somebody's going to tell us what's acceptable, what isn't. I don't like it. The third option is we could just, on the first day, is drop our coverage completely and leave all of our employees. We have 43 out of 58 take the coverage and just drop the coverage. And we're not going to do that because I'm not going to do that to our employees. I mean, there's enough turmoil going on. I don't need to add turmoil to their lives. I'm not going to do it. So we have to do something. Somehow we have to adjust to this, and I can only plead, I guess, with the committee that you go in the direction of the free market and to trust the free market. It works everywhere else. I was talking to Mr. Richardson. I said, why are hamburgers so cheap? And I was being facetious. He actually was going to tell me why. But they're so cheap because people compete in the hamburger business. The government doesn't run the hamburger business, not yet. So I see my time is up. So I appreciate the time, and thank you very much, and I look forward to your questions.
Thank you for noting that. Ms. Miller.
Chairman Issa, Ranking Member Cummings, and distinguished members of the committee, Thank you for inviting me to testify before you today on the impact of the health care reform on job creators and the economy. My name is Mary Miller, and I am the CEO of JanCoA Janitorial Services, headquartered in Cincinnati, Ohio. I'm honored to be here today on behalf of the U.S. Chamber of Commerce. This year, we're celebrating our 40th year in business at JanCoA. We are a family business with literally clusters of small families within our business. My husband was a student at the University of Cincinnati when his economics professor casually mentioned vendor contracting, such as janitorial services. Noticing how dirty the floors were at the local bar, he thought cleaning would be a way to pay for bar tabs. With going to school full-time and working another job already, he started hiring friends to help him. When his father, Bill, went to have heart surgery, Tony promised to take care of the family. His father died, and at the age of 19, Tony left school and created JanCoA to support his mother and 3 siblings. Today, our company has 320 full-time employees, and we clean more than 10 million square feet just in the greater Cincinnati area. One of our most important duties is to attract, train, and motivate quality employees. Our business model helps us do this. Unlike the majority of janitorial companies, we rely on full-time employees. In fact, 98% of our employees are full-time, and we have very low turnover, nearly half of the industry's national average. We find most people in our community want full-time work, and our company does better with full-time employees. This is an important win-win. By hiring nearly exclusively full-time employees, we are better able to recruit, retain team members, and improve efficiency, productivity, and quality. We also offer good benefits, including vacation pay, paid holidays, health insurance, coverage, and what we call the Dream Manager program. Although our Dream Manager program is a source of great pride for our company, given the brevity of my time and the focus of the hearing, I will limit my remarks on it and simply say that the Dream Manager program has been responsible for many of our employees realizing the American dream. It has helped our employees become homeowners, achieve economic independence through starting their own small business, and further their education by earning GED and/or college degrees. In short, it exemplifies our mantra of taking the dead end out of dead-end jobs and to let our employees grow. I hope you will read more about it in my written testimony. One of the benefits we offer, which very few of our employees take advantage of, is health care coverage. We offer a PPO to all our full-time employees and pay an average of 85% of the premiums, but less than 6% of our employees take advantage of this coverage. The vast majority of our employees have historically chosen to take home their earnings as wages to pay their bills. The coverage that we can't afford to provide is subject to a $6,000 annual limit, and it is a limited benefit plan. Our issuer got a waiver so that we can continue to offer this coverage to our employees until 2014. Sure, this is not an ideal coverage, but it is what we can afford to offer and allows them an option of some coverage at a very reasonable price, $20 to $30 a month. However, come 2014, when the employer mandate and the individual mandate kick in, neither our company nor our employees will be able to make these choices about health insurance. Our company will no longer have the option of offering this type of plan to our employees, will no longer have the freedom to choose how to spend their wages. Even worse, the law will force my husband and me to choose between several impossible options in order to remain in business. This will jeopardize our ability to offer jobs that our employees value. We face additional costs that exceed $1.4 million in premium cost increases over 400% because of this law. It's a devil's choice. No matter what we do, our company and our employees will suffer as a result. As many in the service industry know from me, raising prices is not an option. Most janitorial companies rely on part-time employees and therefore will not be subject to such penalties and employer mandate. It certainly seems to me like the law creates very perverse incentives, particularly in this economy when jobs are on everyone's mind. Why would you penalize businesses for hiring full-time employees and provide a competitive advantage to those businesses that limit their hours and their employees can work? These perverse incentives will negatively impact businesses such as ours that want to hire full-time employees. Regardless of how much better my services are, there's only so much a customer is willing and able to pay. In conclusion, Although my employees prefer full-time employment and I prefer to hire full-time workers, this law may force me to reduce the majority of my team members to part-time employment. This will destroy the foundation of which my company was built and the quality of life we are trying to help our employees achieve. Regrettably for me and my employees, the new health care law is a dream killer. Thank you.
Thank you. We have 15 minutes on a vote on the House floor. So counting 5 and 5, I can get you both done if you stick to the 5, and then we'll come back immediately following the votes. Senator Wolf.
Thank you very much, Mr. Chairman. I will strive to do as best I can. Good afternoon, and my sincere thanks to the committee for the opportunity to testify to such an important issue for the American people. I come before you today to share the perspective of a person who, thanks to the hard work and dedication of a team of remarkable individuals, has achieved amazing success in one of the most challenging industries in the country, the airline industry. 25 years ago, as a trained and licensed aircraft mechanic and pilot, my dream was to start an airline in Massachusetts. And with one airplane, one route, and 6 employees, Cape Air flew our first flight in 1989. Today, headquartered in Massachusetts, Cape Air operates in 11 states, 4 U.S. territories and commonwealths, and 3 foreign countries. We will carry over 725,000 passengers this year and generate more than $105 million of revenue. As a member of the Alliance for Business Leadership, Cape Air now offers nearly 1,000 full-time jobs, with about 500 of them based in Massachusetts, and they're full-time jobs. Nearly 300 of our employees have been with the company for more than a decade, and our employees share the ownership in the company with us. Cape Air's success allowed me at the age of 52 to enter government 2 years ago, and the voters from the Cape and Island chose me to represent them in the Massachusetts State Senate. My primary goal in this capacity is to help government and private business partners in ways that make our communities healthier and make our economy stronger. They are not mutually exclusive. What's also informing my perspective, other than the Cape Air experience, is 6 years on the Federal Reserve Board Advisory Council for New England, the chairman of the board of one of the largest chambers of commerce in the Commonwealth of Massachusetts, and I also serve as a trustee of the largest mutual bank in the region, Cape Cod 5-cent Savings Bank. From all of these vantage points, I've come to realize that one of the most important values that we must embrace is that every American should have access to affordable and excellent health care. And I'm really proud that we have come a long way towards accomplishing that goal in Massachusetts. We've done so without stunting business growth, and we've done so without cutting jobs. One of the reasons I'm here today is to debunk some of the myths and dispel fear and misunderstanding about the 2006 Health Care Reform Act that Massachusetts enacted with strong bipartisan support, and I stress, strong bipartisan support. In the State Senate, the vote was 40-0 to enact that law in Massachusetts. It is also the template for much of the Affordable Care Act, now sanctioned as a law of our land. From Cape Air's first day in business, we've offered health care coverage, knowing that affordable health care coverage helps us to retain a great workforce, and it has. This year, Cape Air's health insurance premium will cost close to $3 million, roughly 3% of the company's gross income. The company will pay just over half of that cost, and the employees will pay the rest. In 2007, when Massachusetts health care reform went into effect, there were dire predictions of the impact on businesses like Cape Air. Here's what really happened to our business. We added some new dependents under 26 years of age to those of us in our company who had family plans. Beyond that, the transition was seamless for us. There was no bureaucracy, no heavy lifting in the front office. Since then, we've added a solid 15% more Massachusetts-based jobs, with our total revenue growing far faster. Health care reform in Massachusetts has not stifled business. The health care reform was designed to ensure access, not curtail cost. And with landmark legislation now close to passage, building on the success of the 2006 Act, Massachusetts is on the verge of implementing new strategies to contain costs, while continuing to provide coverage for more than 98% of our Massachusetts residents. and that bill is now in conference committee in the Massachusetts legislature. I can also report that health care costs have not spiraled because of this plan. They have not spiraled. This year, CAPR saw a 5% increase in premiums, too much, but far from the 15 to 20% increases we saw year after year before this reform took effect. Last year, our increase was 4%. The previous year, we were able to negotiate a 5% decrease in premium. That's after the passage of the law. Our success should be taken in the state context. Unemployment in Massachusetts has dropped from 8% in 2009 to 5.8% in May of this year. That is 2.4% below the national average. Since January 2007, Massachusetts has ranked third in the nation in economic performance, as defined by our gross state product. And our bond rating in the state is a AAA bond rating, the best in the United States. Meanwhile, additional state spending for health care programs resulting from payment reform only represented 1.4% of the state budget in 2011. Again, with more than 98% of our residents covered, which includes a 400,000 net increase in the number of non-elderly insured residents.
Senator, your entire statement will be placed in the record. If you could please wrap up.
Just have 4 paragraphs, quick ones. Is that okay?
Pick one.
I'll read them quick. Okay. As important and positive as enacting the Affordable Health Care is now and will be, it's not the last word. Just as Massachusetts is now moving forward with cost containment initiatives, there will be more opportunities to continue and reform our health care structure. Access is only one of the pillars on which great health care is built. The others to address are cost, complexity, outcomes, and transparency. I look forward to a national conversation about all of them, and especially a better understanding of the link between a healthy business climate and access to health care for all. Thank you.
Thank you, Senator. Dr. Goodman.
Mr. Chairman, members of the committee, the Affordable Care Act will impose very high costs on the private sector of our economy. The minimum health benefit for a family will cost almost $6 per employee per hour. When you combine that health minimum wage with a money minimum wage, it means that employees will have to produce at least $13 of goods and services every hour, or they'll be priced out of the labor market. That's why hundreds of thousands of low-skilled workers are in danger of losing their jobs. The Act will impose about $500 billion in new taxes over the first 10 years, and it will do so in ways that will reduce investment, reduce output, and reduce employment. The Act creates very high marginal tax rates for moderate income families. If we could have the first slide to demonstrate that. Moderate income families are going to discover that they get to keep less than 40 cents of each additional dollar they earn as a result of the phasing out of the subsidies for health care as well as other taxes. In addition, the Act creates a bizarre system of subsidies. There is no help in the legislation for $10, $15 an hour workers at McDonald's and Wendy's and Walmart and corporations like that. No additional help at all. And yet, if one of these employers decides to completely end its health plan, all of those workers can go over to a health insurance exchange and get from $10,000 to $15,000 of subsidies and maybe even more. These subsidies, by the way, are in danger of causing a complete restructuring of business, not for sound economic reasons, but just in response to the subsidies. If I could have the second slide. Economists at Stanford and the University of Chicago have created an uncertainty index, and they have found that we're now at the highest point that we've been over the past 30 years. They have concluded that public policy uncertainty is responsible for the loss of 2.3 million jobs over the last 4 or 5 years. And one of the reasons for that is the Affordable Care Act. Employers, if I could have the final slide, employers are responding to these conditions in certain ways that create a jobless recovery. What has happened is that hours of work have actually increased. In terms of the number of hours employees are working, the recession is over. We're back to normal. What's not normal are the number of people being hired. In terms of being hired, it's as though the recovery has not even begun. Under the Affordable Care Act, there is no penalty for having employees work additional hours. There are penalties for hiring additional employees. And let me just say something about the Massachusetts experiment, because I've looked at it. It hasn't bothered employers very much because all the expansion is in terms of subsidized insurance. All the newly insured people are either in Medicaid or they're getting subsidized insurance. They're not getting additional insurance from employers. And contrary to the statement you just heard, nobody's getting more health care in Massachusetts today. There are no more doctors. There are no new nurses. There are no new clinics. It's the same amount of health care is being delivered now as was delivered 4 or 5 years ago. More people are going to hospital emergency rooms than before the reform was passed. More people are going to the community health clinics. Basically, people are going to the same places they went before. They're getting the same care that they got before. And all that's happening in Massachusetts is we're just moving a lot of money around. Thank you, Mr. Chairman.
Thank you. The committee will stand in recess until approximately 10 minutes after the last vote, which should be in the 2:40, I'm sorry, in the predictions have moved, in about the 3:15 time frame.
Oh, thank you. It's a good story. I love the story. Great job.